Obsessive-compulsive disorder, or OCD, is defined by recurrent anxiety-provoking thoughts or images that seem irrational and beyond control, or obsessions, and seemingly irresistible urges to engage in thoughts or behaviors that tend to reduce the anxiety, compulsions. Obsessions are unwanted, intrusive thoughts, images, or urges that trigger intensely distressing feelings. Compulsions are behaviors an individual engages in to attempt to get rid of the obsessions and or decrease his or her distressed feeling. Obsessive compulsive disorder symptoms are hand washing until your skin becomes raw, checking doors repeatedly to make sure that they're locked, checking the stove repeatedly to make sure it's off, counting in certain patterns, silently repeating a prayer, word, or phrase, arranging your canned goods to face the same way. A personal observation behavior of ensuring all the screws on the light switch in a house are vertical was a personal one of mine. I had a family member who could not go into any house without looking at all of the screws in all of the wall plates that were in the house. She had to check every single one of them to verify that they were in the vertical position. And if they weren't, she would take a little screwdriver out of her pocket and adjust them. It became almost crippling because everywhere we went, she would have to check. She sought help and since has this compulsion under control. Researchers suggest that OCD involves problems in the communication between the front part of the brain and deeper structures of the brain. These brain structures use a neurotransmitter, basically a chemical messenger called serotonin. Pictures of the brain at work also show that in some people, the brain circuits involved in OCD become more normal with either medication that affect the serotonin levels or serotonin reuptake inhibitors or SRIs, or cognitive behavior therapy, CBT. Doctors and researchers are divided on what causes OCD, but many believe OCD is the result of abnormal brain circuitry function. It tends to be genetic, and symptoms often begin during childhood. Causes of OCD, or obsessive compulsive disorder, isn't fully understood. Main theories do include biology. OCD may be a result of the changes in your body's own natural chemistry or brain functions. Genetics. OCD may have a genetic component, but specific genes have yet to be identified. And learning. Obsessive fears and compulsive behaviors can be learned from watching family members or gradually learned over time. Exposure and response prevention, or ERP. The Table 13.1 for evidence-based practices in the Psych 6 textbook calls out ERP as an effective treatment. ERP has been identified as one of the most effective treatments for OCD, sometimes labeled a gold standard. ERP involves making a choice not to do a compulsive behavior once the anxiety or obsessions have been triggered. ERP leads to habituation, where people learn that nothing bad happens when they stop performing its rituals. Steps to ERP. We get a detailed description of the obsession and compulsions. We rank the list from least bothersome to most difficult. We design exposures or challenges that trigger the OCD. We start with the least bothersome, and a person attempts to avoid compulsive behavior for increasingly longer periods of time. They repeat the exposure until the associated anxiety decreases to a manageable level, and they work toward most difficult by repeating exposures and avoidances. Cognitive behavior therapy, or CBT, focuses on changing the beliefs, attitudes, and automatic types of thinking that create and compound people's problems. They recognize the brain is sending an error message. We identify specific problems or issues in your daily life. They become aware of unproductive thought patterns and how they can impact your life. There's identifying negative thinking and reshaping it in a way that changes how you feel, and learning new behaviors and putting them into practice. CBT strategies, cognitive restructuring, or reframing negative to neutral or positive thoughts. Guided discovery. Therapist acquaints with the situation and asks questions to challenge or broaden the thinking. Journaling, writing down negative thoughts and what positive thought could be an outcome. Activity scheduling, put it in your calendar to remove the burden of the decision. Behavioral experiments, predict what will happen and discuss afterward if the prediction came true. Relaxation techniques, deep breathing, muscle relaxation, imagery. Role playing, play out multiple scenarios. Successive approximation, break down the big task into smaller, easier, manageable tasks, kind of like eating the elephant, one bite at a time. Summary: obsessive compulsive disorders, or OCD, is when an obsessive behavior leads to a compulsive response. Exposure and response prevention, or ERP, is the gold standard for treatment. Cognitive behavioral therapy, or CBT, is a multi-approach to behavioral correction.